No matter what you do, you're likely to use solvents in some part of your job. Solvents are among the most common chemicals in the workplace. Because they can dissolve other materials easily, they're used in cleaning solutions, paints and adhesives, degreasers, and even medical processes. Solvents can also be hazardous if used improperly. In addition to being a health hazard, many solvents are also flammable. In many cases, solvents are used in ways that would qualify as hazardous leaks or spills for other materials. Because they're so common, it can be easy to forget that solvents are hazardous materials. That can make it even easier to make mistakes that could cost you your health or your life. By remembering some important safety rules, however, you can work safely with solvents in any job you do. Solvents are substances used to dissolve other materials. Some of the most common uses include degreasers, paint and adhesive thinners, dry cleaning chemicals, and household cleaners. Many common materials like paint and glue use solvents to keep them in liquid form until they're used. The solvent then evaporates on exposure to air, leaving the paint or glue behind to solidify. Some of the most common chemical solvents include toluene, kerosene, acetone, and carbon tetrachloride. Chloroform, turpentine, and wood alcohol are also solvents. Even water is considered a solvent. Many solvents fall into groups or classes according to their characteristics. Alcohols are commonly used to dissolve shellacs, vinyls, and epoxies, and are also used in some kinds of antifreeze. Aliphatic hydrocarbons are used in coatings and insecticides. Some, such as gasoline and kerosene, are more often used as fuels. Aromatic hydrocarbons, such as toluene, styrene, and benzene, are named for their sweet odor and used in glues and veneers. Glycols are water-soluble and used in antifreezes and industrial cooling systems. Less combustible than most other solvents, they still present health hazards. Glycol ethers are more combustible and are commonly used in coatings, resins, and dyes. Esters, such as methyl acetate and isopropyl acetate, have a wide variety of uses, including fumigants and insecticides. Their properties vary widely, as do their fire hazards and health effects. Ethers are used in dyes, resins, waxes, and fuels. Many are not only flammable, but also form peroxides when ignited, increasing the risk of explosion. Ketones are used in dyes and in resins. Some, such as acetone and methylethyl ketone, are extremely flammable. Solvents are useful for a number of reasons. In addition to dissolving other materials, many of them evaporate quickly, leaving little or no residue behind. Some can also displace water efficiently and are used as drying agents in electronic components. But the very features that make solvents useful also make them dangerous in many ways. Because they can dissolve other materials and displace water, they may also dissolve or dry out your skin and mucous membranes, leaving you open to infection or other damage. Because they evaporate quickly, their vapors can get into your respiratory system and bloodstream. If a solvent happens to be flammable, those vapors can also react explosively if there is an ignition source. And because there are many different types of solvents, you must be aware of a different set of hazards for each one you use. You can control these hazards by learning the proper ways to store and handle solvents. All it takes is one spill or leak to put you at risk from a variety of health and safety hazards. Each solvent has a different job and different characteristics that make it right for that job. The hazards you face depend on the type of solvent you use. The best way to learn about the materials you work with is the Material Safety Data Sheet, or MSDS. Your employer is required to have an MSDS for each material you work with. The MSDS provides detailed information about the material, including its name, chemical makeup, description, and hazards. In addition, it gives you important information on the type of protective clothing required to work with the material and emergency and first aid measures in case of accident. Make sure you read the MSDS before you begin working with a particular chemical. Your health or safety may depend on it. One of the most common hazards solvents pose is the health risk due to their vapors. Many solvents are volatile, which means they evaporate quickly at room temperature. These vapors can enter your body through your eyes, nose, and skin. If you've ever felt dizzy while working with paints or adhesives, you know what the vapors can do to you. Dizziness is just the first stage of exposure to solvents. It is one of the acute or short-term effects. Other short-term effects include burning, watery eyes, nose and throat irritation, skin irritation, headaches, and nausea. If you experience these symptoms, the vapors have reached dangerous levels in your work area, and you must leave immediately to prevent further harm. Get to fresh air and seek medical attention right away. These symptoms are caused when the molecules of solvent vapors actually replace oxygen in your bloodstream and are then carried to your brain and other organs. There, the molecules can cause permanent damage. Symptoms often resemble intoxication from alcohol or drugs. In fact, the effects are the same, and in some cases the victim may stop breathing or fall into a coma. Solvent vapors can enter your bloodstream in two ways: inhalation and absorption through your skin. If you inhale solvent vapors, molecules pass through your lungs just like oxygen and enter your bloodstream, where they're carried throughout your body. Some solvents can pass directly through your skin and the walls of your blood vessels and enter the bloodstream. The effect is the same as if you had inhaled the vapors. Because solvent molecules replace oxygen in the blood, they are delivered to all of your organs. Instead of oxygen feeding them, however, the solvent poisons them, creating long-term or chronic effects. Some of these effects include permanent vision damage, liver and kidney disease, and damage to your nervous system. Your body's largest organ, your skin, can also suffer chronic effects. One of the most common is contact dermatitis, a painful condition marked by red blistered skin. Contact dermatitis makes your skin more sensitive to further damage from solvents and leaves it open to infection from bacteria. Remember, each solvent has a different set of effects. Check the MSDS for the solvents you work with to determine what risks they pose and exposure symptoms. No matter what the risks, treat all solvents as hazardous materials and protect yourself from direct exposure. In addition to posing health hazards, many solvents are also flammable. You can find out from the MSDS if the solvents you work with are flammable. The MSDS also provides important information on the material's flash point and explosive limits. The flash point is the lowest temperature at which a liquid gives off enough vapor to catch fire if an ignition source is present. Many solvents have flash points at or near room temperature, so they require extra care in storage and handling. The range between the upper and lower explosive limits is the point at which the vapors given off by the material will ignite and burn. Below the lower limit, there is not enough material to fuel a fire. Above the upper limit, the concentration of fuel in the air prevents the fire from getting enough oxygen to ignite. Other important factors to know when handling solvents are their boiling points and rates of evaporation. If a flammable solvent evaporates quickly, it can also pose an explosion hazard. In a closed area, vapors can saturate the air, allowing fire to fill the space almost instantly. That means there is no time for escape. Because different solvents pose different types and levels of health hazards, it's important to know how to protect yourself from each one you use. The MSDS is your best guide for minimizing health risks while handling solvents. In addition, there are some general rules to help you work safely with solvents. Before working with any solvent, read the label so you know its hazards and any special precautions you need to take. Never use solvents from unmarked containers. Even if you know what it is, you may not be able to tell others if there is an accident. Any delay in treatment could cause permanent injury or even death. Store and handle solvents only in approved and chemically compatible containers. Many solvents dissolve plastic containers and must be stored in glass or metal. Keep containers tightly closed when not in use. Carry glass containers in an approved rubber cradle designed to protect the container if it is dropped. Read and follow the manufacturer's directions for each solvent you use. Proper use can reduce the risk of accident or exposure. Never use solvents for anything but their intended purpose. Many solvents can attack and destroy plastics and react disastrously with other chemicals. As with any hazardous chemicals, never eat or drink in areas where solvents are being used. And of course, no smoking. If you work directly with solvents, use the tools provided to limit your exposure. Use tongs and dunk buckets for immersing parts, and make sure brushes or applicators are compatible with the solvent you're using. Remember, solvents have several ways of getting into your body: by ingestion or inhalation, by exposure to mucous membranes, through cuts or scrapes, and by absorption through your skin. In many cases, symptoms occur only after severe damage has been done, so by the time you know you've been exposed, it can be too late. Because solvents are often used as cleaning agents, thinners, and degreasers, even proper use can expose you to enough vapors to injure or kill you over time unless you wear the required PPE and follow the manufacturer's directions. And because vapors starve your brain of oxygen, you may lose the ability to think clearly and recognize that you are in danger. In addition, you may pass out from inhalation exposure and continue being exposed while you are unconscious. One of the best ways to protect yourself is with proper ventilation. Circulating fresh air through the work area can keep vapor concentrations down and minimize exposure. Ventilation also helps keep vapor concentration below the lower explosive limit, reducing the risk of fire or explosion. Always use the ventilation provided in your work area to keep vapors from reaching dangerous levels. If you have trouble breathing, if you start to feel dizzy or faint, or if you smell or taste an unusual amount of solvent, alert your supervisor or safety official immediately. In some cases, it isn't possible to ventilate the work area sufficiently. Epoxy paints, for example, release large amounts of solvent vapors over a wide area when they're applied. Even in a well-ventilated space, vapors can reach you before they are removed. Personal protective equipment, or PPE, can help protect you from exposure. PPE includes protective glasses with side shields, respirators, gloves, aprons, and other items to protect you from solvent vapors and spills. Be sure you're using the right PPE for the material you're handling. The MSDS contains information on the PPE you need for each material. Gloves, aprons, and other PPE come in different types of materials, including rubber, neoprene, and various plastics. PPE that protects you from one solvent may dissolve when exposed to another, with deadly consequences for you. Make sure PPE fits properly, especially your respirator. Remember, solvent vapors can pass through your skin, so a loose respirator mask is practically useless. In fact, It can be even more dangerous than none at all, since vapors can concentrate inside the mask. Always wear full eye protection when handling solvents. If you wear contact lenses, be aware that they provide no protection and can make first aid more difficult if you do get solvent in your eyes. Emergencies with solvents can range from skin contact or inhalation to fire or explosion. No matter what the emergency, your best weapons are knowledge and preparation. Learn all you can about the hazards of the solvents you are handling. Read the MSDS and the manufacturer's label before working with it, and take all necessary precautions. Make sure you know the locations of emergency eye wash stations and showers and fire extinguishers. If you or a co-worker are splashed with solvent, rinse the affected area with water right away and seek medical attention. If solvent splashes in your eyes, go to an eye wash station and flush your eyes with water for 15 to 20 minutes. If it gets on your skin, use a safety shower and rinse the area for the same amount of time. In case of a solvent spill or fire, do not try to handle it by yourself unless you've been properly trained and the situation is manageable. Evacuate the area and alert your supervisor. Do not enter the area again unless authorized to do so. Solvents are common throughout your workplace, but can be dangerous if not handled properly. Knowledge and preparation, plus good work practices, will let you get the most out of these materials and help keep you working safely.